Hey there, everybody. Welcome to Master Your Metabolism. My name is Brooke Masters, and I am one of the coaches here and wanted to share a little bit today about perimenopause and menopause and provide some education because I've been getting a lot of questions and people that don't understand, especially women that don't understand what's going on in their body, and men that don't understand what has been changing with their wives or partners. And I wanted to shed a little light and understand what is actually happening and some things that you can do to help. So, first and foremost, for me, I started going through this, had no idea what was happening. I was experiencing anxiety, weight gain. I had all these weird symptoms that didn't really seem related. Joint pain, started having really dry skin, my hair was falling out, I started having vertigo, like all of these symptoms that seemed unrelated, and come to find out later that they all somewhat are related because they were due to hormonal dysfunction. So as we get older, just to understand anatomy and physiology, as we are getting a little bit older, our hormones start to downregulate. The first thing that starts to come down is progesterone. That is the first hormone, which is our calming hormone. That is what will help with anxiety, help with sleep. And when that is down, you start seeing some things with nervous system regulation. You start feeling like you're not quite yourself. Then next comes testosterone. Testosterone is not just libido, but actual motivation. It can impact your insulin sensitivity, which can in turn lead to weight gain. There's lots of things that it does impact, like sleep and getting you in that restorative sleep. Estrogen. Estrogen is the hormone that does this throughout perimenopause. So whereas when we were younger and just got our cycle, you could kind of say, well, she's getting her period, she'd be holding water, get bloated, she would have skin changes, things happen, and then it would be done and things would be over with, right? Very predictable, same things that would happen each month, somewhat. But with perimenopause, symptoms are all over the place. And because the hormones fluctuate so much, it is where we see excessive symptoms and they seem totally unresponsive, unrelated. And why is this happening? Estrogen receptors are all over the body. So that's why we could see things with skin, because it does play a part in the production of mucus for certain membranes, like vaginal dryness. You can start seeing skin dryness, your nails get brittle, things like that. And some things that could help, like people that get itchy ears, taking Flonase on like a Q-tip and putting it inside of your ear. But understanding that this dryness is coming from changes in your estrogen, things like headaches, dizziness, lack of focus, brain fog. You can get bad breath. Like I said, your nails, you start getting achy joints because, again, when you have that drop in estrogen, your joints start to ache. You can also start seeing changes in your labs. I remember my cholesterol was going up and my A1C, and nothing had changed regarding my diet or my training. So, starting to understand that these things are happening not because anything that you're doing, but just due to some changes in your hormones. Like I mentioned, nervous system regulation. So sometimes people are diagnosed with fibromyalgia. When things start happening, you get these like shock feelings or like burning mouth or tongue. Your skin feels like something is like crawling on it, ringing in your ears. All of these things are because your nervous system, which is regulated from your hormones as well, starts to become dysregulated. So things that you can take are magnesium glycinate, which helps to calm those firings of nerves, vitamin B, thiamine, B12, ALA, alpha lipoic acid, is something else that helps with an antioxidant with free radicals and also helps with your nerve health. They use it a lot with diabetics and their neuropathy, but it can also help with making sure that your blood sugar is controlled, making sure that you are really watching for the signs that you feel dysregulated. You can do things like taking an ice pack and putting it on your neck or your chest when you start to feel anxious or that your system feels a little bit off. Sour candy will also pull you out of that like fight or flight type of state. There is something else that I use, these little boom boom sticks. And it's just a little stick that you can get on Amazon, and it's essential oils that you do some deep breathing with that will also help to calm your nervous system. So those are some things that can help with again, fluctuations in estrogen, understanding what's going on, as well as nervous system regulation. But another thing is histamine responses. So when you're in menopause, because of those, erratic fluctuations with estrogen, you can set off these histamine responses due to those fluctuations and decline in progesterone. So this disrupts that histamine. It's normal to have a little bit, but when it starts getting dysregulated, that's where you start seeing things like flushing on your face, migraines, anxiety, digestive issues. You can see eczema. Those types of things are due to that histamine response and that overload of histamines, because estrogen is what does that. And then you have this DAO enzyme that will break down those histamines, which you don't have. So using things like an antihistamine like Claritin, Zyrtec, Pepcid will help the histamine response. And then something like quercetin to help control those histamines. Again, digestive issues, you could start seeing bloating, heart palpitations, and with low progesterone, the same thing, that you are going to see more anxiety. And the reason for that is, again, it is responsible for GABA, which is that calming hormone. So using things like a supplement of GABA or L-theanine with magnesium glycinate, that combination is really helpful for sleep. So that is something that you can try before bed. Some people find more relief from like a magnesium topical, either a spray or a cream. Some of the muscle soreness and muscle pain, that is really helpful with, but also for rest and relaxation, especially if you have digestive issues that maybe you're not absorbing some of the foods that you're eating or the supplements. Something like magnesium, you may not actually get the benefits from. Something like a topical works better for some people, but testosterone, again, this is something that is not just libido, right? Testosterone is also responsible for your motivation, actually wanting to do things, wanting to actually be a part of things, wanting to go work out, wanting to go be a, part of the group or do things with friends and family. Besides the point of the weight gain and not feeling like yourself, if you don't have those hormones that are going to kind of like make you feel like being you, that's a problem. And testosterone specifically, I know a lot of doctors will just kind of like, well, maybe you're just not attracted to your husband, or, this is part of getting older. But this is something that can impact relationships. When your spouse or your partner thinks you're not attracted to him because you're not in the mood, that is something that can cause friction and can cause a change in your relationships. And for me, I wasn't willing to risk something happening with my marriage just because I was being scared out of like doing some type of therapy or finding ways to combat that. So, natural route, maca root, is that something that is going to be as good as hormone replacement? Probably not. But will it give some relief? Yes, some people are getting some relief from maca root. Black cahoosh is something that helps with hot flashes. Wild yam cream, some people find relief. But again, understanding that there are treatments, and bioidentical hormone replacement is something that is available. That recently, there are many years that women were afraid to take things. They were told it was going to cause cancer. Those warnings for some of the hormones have been removed, and there is now more recent research to see the benefits, cardioprotective benefits, cognitive protective benefits through use of estrogen. But again, all therapies should be done through a provider that you trust. And all decisions should be made on not just your labs, your symptoms, but also making an educated decision of knowing the risks and the benefits of all of the therapies. So I tell people progesterone, first one was that most people are put on. A progesterone is usually an oral pill. You take it in the evenings because it's a calming hormone, right? So that is something that can come compounded, that you get from a pharmacy, or some insurance companies will cover it, but it is not a compounded bioidentical form. So many people cannot tolerate the one that they get through insurance that happens to be less expensive. They do better with some type of compounded bioidentical progesterone. As far as when you take a progesterone and an estrogen, they balance one another. The only estrogen that should be taken, that can be taken alone, would be a vaginal cream. Does not, it is put in for vaginal dryness to prevent UTIs and any type of infections, vaginal dryness. That is something that does not need progesterone to balance, but you can take progesterone by itself. The next hormone, because your testosterone is the second hormone to drop after progesterone, that is typically the next that people see symptoms. So you want to have testosterone in order to build and maintain muscle, not just libido and motivation, but that muscle is what's needed to be able to keep you strong in your later years. And having that strength allows you to live independently because you have muscle mass. People that are not taking hormone replacement are at risk for falls. You see osteoporosis and these things that happen to women that they fell, they were okay before. And then all of a sudden, out of nowhere, after they fell, their health deteriorated. And it is because the muscle is what helps with longevity. It helps you to catch your fall. It helps you to live independently because people are intact but having to live in facilities because they don't have the strength to carry their groceries out of the car, pick things up and put it on the top shelf. So having muscle mass, and I tell people now, working out is essential. It is not for fat loss, it is for strength. It is for strength and longevity. That's how you have to think of working out. I hated working out, but now I see it as a purpose and something that is going to keep me strong and living independently so my boys don't have to take care of me. So testosterone comes in different routes as well. Testosterone comes in cream. And just be warned that with certain creams, you have to be very aware that if you have pets or a partner, it is something that can be spread onto somebody else. Also, the testosterone does come in pellets, is what they're called. It is a large amount of testosterone shot through a large needle into your glute. The thing about that is it is not how your body gets hormones. So typically how your body is hormones, it's a constant level. And when you have the pellets inserted, it is a large amount of testosterone put into your system. There is no taking some out. Once it's in there, it's in there. I have seen episodes of cellulitis. I have seen people that have massive side effects. And if you think of what happens with a lot of testosterone, it's like PCOS and autoimmune. You can have oily skin, you can have acne, you can have anxiety, you can have weight gain from insulin resistance. Some women, great. You feel like a 13-year-old boy. You've got the, sex drive of a 13-year-old kid. That's great for a month. And then you crash and feel like garbage again. So for me, what I use personally is an injectable, and I do it twice a week to keep my levels straight. It is something that I have the ability to be able to change the dosage if I want. So it is not something that is as risky as something like the pellets. It is a small little insulin needle. It is like 2 units, a small little amount. It goes in twice a week. Again, it's all based on your needs, what your labs say, and what you're reporting to your practitioner. There is estrogen therapy. That is typically the last thing because many people could either aromatize from testosterone into estrogen, or if they require estrogen, you can use a cream as well. Again, you can use the vaginal cream for vaginal dryness, prevention of UTIs and things like that. They also have certain estrogen creams for the face because you will notice also because your skin gets very dry, you don't have as much collagen production, you'll see changes in your skin. Just be very mindful of the certain types of estrogen creams because they can cause darkening spots on certain people depending on your reaction to it. But again, estrogen can also be a patch, which is something that you would put in certain areas of your body. And it does have an absorption issue with some people. And then the last thing is with estrogen, you do have an injectable the same way that you can with testosterone. You'll be put on a schedule, and sometimes they put it with the testosterone. But again, those are the modalities that you can choose from. And you just want to have all of the information to be able to make the decision of what works best for you. But when you are going through perimenopause with any type of hormone replacement, it is always best to be able to look at what you're feeling right now. And when you start earlier, then you have the ability to prevent many things from happening, like osteoporosis. I've had women that have come to me that now their bone density scores are going down. They're scared, they're nervous. But if they had started, they would have been able to prevent some of those symptoms. So, making sure you're weight training to protect your joints, protect your muscle, protect your bones, having the therapy on board based on your labs, your symptoms, and also understanding that you are not losing your mind. You are going through things. You no longer have the same buffers for stress as you used to. All of our lives, many of us have been caretakers for whether it be kids, spouse, partner, you know, friends. If you are the person that has always been pouring into everyone, you may find when your symptoms start hitting that you don't have the same tolerance. You don't have the same ability to buffer stress as you used to. Little things like your husband chewing too loud, those things may bother you, and it's not in your mind. It is something physiologically going on. So, understanding what is happening, number one, is what made me feel better to say there's actually something happening. Learning the different things, some of them I shared with you. Again, something simple when you feel totally dysregulated, because that was usually the first symptom for women of I don't feel like myself. And I feel like the littlest things are like triggering me. I'm waking up and I'm anxious. Those are the times that we need to put in, like doing some deep breathing, waking up in the morning and doing cold on our face. Some people do cold plunges, but I tell people if you are someone who is completely dysregulated, putting your whole body in that might be too much for a system that's already dysregulated. So putting your face in cold water in the morning, again, pairing it with like brushing your teeth or something you're already doing. So it is a habit that you can start doing to help to bring down your system. Ice packs. If you're starting to feel very anxious, taking some deep breaths, putting a cold ice pack on your neck or on your chest and taking some deep breaths could be helpful. My little boom boom sticks, sour candies are something else that helps with nervous system regulation. But again, understanding that even though we feel fine, our bodies are typically in this heightened fight or flight response all the time. So if you're noticing weight gain, you're noticing brain fog, you're noticing low libido, you are noticing that you have no tolerance for the things you used to, you're not recognizing yourself in the mirror. Basic things is making sure that you are getting adequate sleep. If you cannot, try some of those things I suggested with the L-theanine and magnesium glycinate, making sure your room is cold and dark, limiting caffeine, making sure that you are going to bed and waking up at the same time. My favorite thing for telling people to set their circadian rhythm if they have that 3 o'clock wake up call is to go outside in the morning. First thing, get sunlight into your eyes. No glasses, no sunglasses. Sunlight in your eyes actually helps your body produce its own natural melatonin 12 hours later. And when you have your natural melatonin 12 hours later, that is what melatonin comes up to push cortisol down. And that's what keeps it through the night. And then it reverses. Cortisol comes up, wakes you up, and starts slowly coming down through the day. So those simple things can actually make a huge difference. So those are my suggestions. And just remember, because you are in perimenopause, speak to your partner. Let them understand. I understand when I went through it, I had no idea what was happening. So it was hard for me to communicate what was going on. But once you get educated as to what is happening, just being honest and letting them know, listen, it's not that I'm not attracted to you anymore. I don't feel like myself. I don't know what's going on. Guaranteed they see it too. But whether you decide to do hormone replacement or you decide to just go naturally, whatever it is, your most important thing is really communicating, having a support system, having somebody there for you, whether it's a friend that's going through it or some type of support system, so you can make it through this time. Because I will tell you, because you are experiencing this, it doesn't mean that you can't get the best body in your life, because I did. It was just learning how to work with the system that I have now. Because when I got there and I figured it out, it was like, now I feel really strong, because if I can make it through that craziness, I can do anything. The problem is that women are trying to do all of the things that used to work. I cut calories and I worked out and I used to drop weight. Now nothing's working. That's because you're trying to use your iPhone 8 charger with your iPhone 17 phone. This iPhone 17 phone could be the best one yet. You just need the right charger. So when we find that charger, that's where you get the most benefit, because you have figured out what's going on in your system. You have figured out what you need to do to get there and feel better. And you're never going to let that go. And you become that strongest version of yourself because you have to get to that point that you don't care about what people think. Your main focus has to be you and taking care of you. And when you do that, you'll feel so accomplished and so confident, and it will spill over into everything and allow you to be that person that you always wanted to be. So I hope this helps. And please, if you have any other questions or would like to chat, the website is in the show notes. You can book a call. It is free. We can chat and learn more. But thank you so much for tuning in. If you wouldn't mind sharing a review, we'd greatly appreciate it. And until next time, take care.